want to keep the conversation on coronavirus going here. And I want to bring in Dr. Kenneth Moritsugu, former Surgeon General, for this conversation. So, Doctor, I'm wondering, and we've been talking about, we heard just Anjalee saying about increasing the vaccine supply, because obviously this race of getting as many people vaccinated as possible is incredibly important throughout this pandemic. But we see right now in the South those efforts being hampered by these winter storms in Texas, Texas being one of the states with some of the highest case counts. And we see that folks are having to go to warming stations, staying overnight and sheltering in place in places like schools, which seems to me like it could be places for this virus really to take hold and truly spread. So how can the U.S. best handle still testing and vaccinating people at a time such as this?
Well, good afternoon, Kristin, and thank you very much for the opportunity to speak with you and your audience. Well, the thing is that Mother Nature always has a tendency to rule, and even though the best laid plans of people have delivery and production stepping up, the actual delivery in the last mile may be a problem. That really does belie the fact, however, that the best way for us to deal with this pandemic is for individuals to take steps on their own, by masking, by washing their hands, by avoiding crowded venues and activities, and doing that in anticipation of getting their vaccine.
This is Anjalee here. I know that we were just talking about Texas, though, and the fact that, to Kristin's question, we've talked about trying to avoid crowded places, but here we find ourselves in the position where the government has had to force individuals into what would be a crowded space. I know there have been some studies done about taller buildings and the dilution of air as a result. Do you think that this could end up being a super spreader event?
There is always a potential of that. However, I am pretty confident that by having to take these emergency measures, they are also applying those preventive measures as much as they can. By putting people into enclosed safety locations, increasing ventilation, having a larger volume, turning the air over more frequently can certainly reduce the potential for spread.
Looking forward, when they do get to start resuming vaccinations, I just wonder, we've heard so much about, not just from the previous administration, but current administration, about DoD involvement and the idea that the military does have a really good sort of orderly format of completing things. Right now, we've seen some of those sites open up, but it seems that supply is also a constraint. Moving forward, what can we expect based on past pandemics and past use of the joint efforts of FEMA and the DoD to be able to get vaccinations done more efficiently when we know that technology also stands in the way?
Well, in terms of the human element, getting the shots into arms does require an intermediary, somebody to place those shots into arms. And I'm really very enthusiastic about the Department of Defense standing up, leaning in, and being prepared to assist in that intermediary role. There are other activities and programs that are available throughout the country, such as the Medical Reserve Corps, which is a volunteer group of individuals scattered throughout the nation and supported through the Department of Health and Human Services. So I think that once we have the supply, once we have the access, I'm pretty certain that all stops are going to be pulled out, and we'll be able to pull people from the Department of Defense, from the United States Public Health Service, from the Medical Reserve Corps, from the Department of Homeland Security as well.
Doctor, I know that you are very interested in physical fitness throughout this pandemic. I know a lot of folks have started to affectionately call their weight gain the quarantine 15, which is a nice throwback to what a lot of us experienced during our freshman year of college. Um, but I'm wondering, because when I was, we were talking about this a little bit earlier, I thought, I don't know if a lot of people are gaining a ton of weight throughout this pandemic. And then I thought, well, that's just me anecdotally saying that. I actually have no idea. Do you fear of some kind of obesity crisis or people becoming really unhealthy in terms of their eating habits and their exercise throughout this pandemic because we're all cooped up inside?
Well, there are two parts of to my response. One is the obesity epidemic that has been on our radar screen for the last couple of decades, where obesity and overweight has really taken off in the United States, where right now about 70% of our population are overweight and obese. Now, when you couple that with COVID-19, overweight and obesity is definitely a major risk factor for contracting and for having a very untoward outcome from COVID-19. People who are in intensive care units who die are overweight or obese, which can definitely impact their respiratory system, which is the main point of the attack of COVID-19. Now, with regard to the impact of the disease on the epidemic itself, I think that we've got some tactical issues we need to be concerned about. One of which is for safety's sake, some fitness facilities have rightfully been closed by local public health agencies. I think that it's really important to look at fitness centers as being part of the solution and not part of the problem. And that is that by opening fitness centers carefully, using public health principles to make sure that people are not exercising on top of each other, that ventilation is increased, that sanitation is applied, that people who are in the facilities are wearing masks, that can definitely help reduce as you said, the spread, the sedentary lifestyle that unfortunately COVID-19 has forced us all into.
And Doctor, finally, we know that there's also another twindemic happening in the form of mental health, reports of increased overdose deaths from opioids, as well as just generally the combination of stress from this pandemic. What can we do, or what is the outlook for that in addressing it? Because it's going to be a much larger concern than ever before.
Well, you're absolutely right. And the whole underlying principle of this is that our bodies are marvelous instruments. But we are not a unidimensional body. We are not only focused on physical activities and physical needs, we are also focused on mental activities, mental health activities, and the two of them are very complementary to each other. By exercising, by keeping active, by keeping moving, we can actually boost the immune system, which helps resistance as well as positive reaction to infection. There's no question that by being more isolated, by not going into the office for many individuals and working at home, we are deprived of social contact. And therein lies a solution where, we right now, for example, are on Zoom. There is no reason why people can't keep in contact socially by Zoom or by telephone if they don't have the capabilities of Zoom. They need to we also need to continue to stimulate ourselves from a mental basis, such as reading, such as doing crossword puzzles, such as other kinds of activities that will keep us from sliding into a mental abyss. And to your point, opioid use has gone up. Alcohol use has also gone up, and more individuals have mentioned that they are mentally distressed. So this is both a physical as well as a mental issue.
Absolutely, a very important reminder for us all. We were, again, all chatting. We all feel burned out. I know our audience at home does as well. So, definitely a very good reminder to take care of your mental health as well as your physical health. Dr. Kenneth Moritsugu, former Surgeon General, Yahoo Finance's Anjalee, Khemlani, thank you both for joining in on this conversation.